Perfect. I want to make sure you can hear me. All right. I've gotten like 3 messages. It is 6 p.m. It is 6 p.m. At Timothy, 6 p.m. Yes, it is 6 p.m. All right. Sorry. Now that the time has changed, like I find myself trying to get my chores done before I sit down to do health talk, that it takes away time from me. So I apologize. I'm here. All right, let's get started. Good morning, good afternoon, good evening. Welcome to Health Talk with Dr. Mutiat. I am Dr. Mutiat. It's a pleasure to meet you. For people joining me for the first time, thank you. Welcome. And for people that are my OGs that have been with me since the beginning, beginning. Thank you. Welcome. All right. Before we get started, I do my little spiel of this is not the end all be all. Anything, if I say anything here that pertains to you, please make sure you check with your own primary care provider before you embark on anything I say. Everything I say here is for informational purposes only. I cannot be held liable if you go do anything without consulting your doctor. It's not me. I didn't send you. All right. So it is still Women's Month. All right. So I'm going to discuss things that pertain to women. And this month, today, we are going to talk about family planning. We're going to talk about fertility. And we're going to talk about birth control. So I'm going to speak a little fast because I have to go get my hair done. My appointment is at 1:00. So I need to hustle. We need to hustle and get this topic in and out. All right. So I can make my appointment on time. All right. Mr. Koji, thank you for joining. Welcome. All right. So the purpose of this is to educate you guys on all available birth control for you, why you need to do family planning, and how this impacts your fertility. All right. So this is very, very important. I've heard a lot of myths. I've heard about rumors. I've heard a lot of miseducation about this, and I feel like, okay, let me talk about it, because the more people that don't have what I'm looking for, the education, the experience, the backup, whatever, when they talk about this, a lot of misinformation is out there. So let me, that I've got the education, that I've seen the patients, that I've, can talk to people, let me give you the right and proper information. So that's what we have. All right. So when I say family planning, automatically, when I say family planning, hi, Miss Odwanyo, when I say family planning, what does that mean to you? All right. What does that mean to you? Think about that. All right. Family planning, all right, is the ability to control when and where and how many children that you can have, that you want to have, through available science, which is contraceptive, education, and fertility awareness. So it's the ability to control, because you just can't be born in without, controlling or not having things to take care of your children. So you have to know that there are opportunities out there. All right. And that's what we're going to discuss today. All right. Why is it important to have family planning? Why? Number one, the woman's body. After you've had a child, you need to give your body time to recuperate. I know people are like, go back immediately. No, your body has to heal. In Yoruba, when we greet someone about having children, when they just, we say, Eku ewomo. Eku ewomo. Ewu is danger. Eku ewomo, that, so you have passed through the danger of giving childbirth. You've passed through the danger of going through childbirth. It is dangerous. A lot of people don't make it during the process of childbirth. A lot of things changes in your body from conception to giving birth. So you have to give your body time to reset. It's not, we normally say, when we talk family planning, we tell people we say about 18 months to 2 years, give your body time to regulate itself. You just get back into it. Yes, there are women that have done it accidentally or plan that immediately they give birth, they get pregnant again. Some of them survive, some of them don't. Some of them survive, some of them don't. So, but to do it, to take care of your own body, as a healthcare provider, I would say, please give yourself at least 2 years to recuperate. All right. So it improves, why we need family planning is it improves our maternal and child health numbers, for lack of a better word. It reduces our mortality rate, our maternal mortality rate. Do you know a lot of women die during childbirth? Nigeria has one of the highest maternity mortality rate. I know, say that 3 times, right? A lot of women die during childbirth. So, and it's because they don't space. They don't give their body chance to recuperate. They just jump into it. Your body has not rested. And you do another one. It is too much. Please don't do that. All right. Family planning reduces unintended pregnancies. Like I said, some women accidentally, there's this rumor that when you're breastfeeding, there's this myth that when you're breastfeeding, you can't get pregnant. Foul. you will get pregnant. You can get pregnant. Breastfeeding does not stop you from getting pregnant. You can still get pregnant. So a lot of women get pregnant thinking, when they're breastfeeding, thinking, oh, breastfeeding will protect me. No, it won't. You can still get pregnant. I know women. I know friends. I have friends. And when I see them and I'm like, and they're like, yeah, Muti, yeah, I'm pregnant. And I'm like, and she's like, oh, can I? I'm like, see, please, breastfeeding does not prevent you from getting pregnant. You can and you will get pregnant. All right. It enhances financial and emotional preparedness. Having children is not cheap. Having children is not cheap, especially when you live abroad like I live. Having children is not cheap. The emotional wherewithal of raising kids is not easy. It's you and that child, damn near 24/7. Women are handling a lot. They're working hard, taking care of the home, taking care of kids. Emotionally, it takes a lot raising a child. So spacing them out gives the parents, both father and mother, financial. Because if let's say the mother is the one doing the bulk of the work for the taking care of the child, the father is financially handling it. I hope so. The father is financially handling it, but parents are financially handling it, and it's a lot. It is a lot. All right. And also for people that still want to get the education on, that want to do family planning, you can marry, you can have children and still go to school. You can family plan. You can plan your family. Okay. Now that we've talked about why family planning is important, please, if you have any questions, please, ask them in here and I will take them as I go. Don't forget to please share this video. Hit the share button. All I ask is share button. Please hit the share button. Okay. The types of birth control. We have different types of birth control. And before I say this, not one medication on this earth does not have a side effect. All medications have a side effect. Every single one. So before you choose a birth control, you have to you have to know you. Like, I know Mutiat and I know what Mutiat wants to achieve. And I know how Mutiat wants to achieve it. So I will sit down with my own gynecologist. Yes, I have a gynecologist. And I will say, okay, this is the kind of birth control I want. Should I be in the market for birth control? So you have to know yourself. You cannot say, oh, my friend Lagbaja was on the pill, and then that's it. No, Lagbaja's goal is different from your own goal. Mutiat's goal is different from Buki's goal. Mutiat's body is different from Tokwe's body. You need to know your own body. You and your doctor need to sit down, understanding your own body, to develop what birth control is good for you or will be the best for you. There's no 1000%, no side effect free birth control. Even withdrawal method that people are like, oh no, I will just withdraw. You will get pregnant. You will get pregnant. You will get pregnant. Breathing method, you will get pregnant. Withdrawal method, that's a side effect. You will get pregnant. Everything has side effects. Everything has side effects. Okay, so let's just put that out there. There's nothing that doesn't have side effects. There's nothing. As we said, agree, move on. All right. So hormonal methods, these are the birth control pills. You have the pills, you have the patches, you have the injections, you have the vaginal rings, several options, whatever you like. If you're one that you don't like to take pills, there's injection for you. If you're one that don't like injection, there's pills for you. If you're one that don't like both, there's vaginal ring that you can stick into your vaginal canal and it will stay there. All right. So how these ones work is they prevent ovulation. Some of them prevent ovulation. Some of them thicken your cervical mucus. All of them, like they have how they work. Some are progesterone based, estrogen, whatever based. So again, you have to sit down with your doctor and determine which is right for you, with also your comorbidities of what's going on in your body, every other chronic illness you have. You and your doctor needs to sit down and then they'll say, okay, based on what's going on in your body, this is what we recommend for you. That's done. Another method of birth control is barriers. And when I say barriers, I mean condoms. I mean diaphragms, female condoms, options plenty, cervical caps, option plenty. So if you don't want to take hormonal, then you have to use a condom. Side effects of condom, it can break. Pro of condom, it can prevent sexual transmitted diseases. All right. Side effect, you may have allergies to it. Again, there are different types of condom: latex condom, non-latex condom, sheepskin condom, different kind of condoms. Whichever works for you is whichever one you should choose. That works for you. You, nobody else, you. Okay. Another type of birth control is long-acting reversible. Long-acting reversible. What are these? We have implants. We have implants, we have coils, we have IUDs that will be stuck in. We have coils, we have implants. Those are long, and those, I think those ones can be like in there for like 10 years or so, 5 years, 10 years, depending on what your plan is. You can speak to your doctor and they'll find whichever one works for the amount of years that you want to, and they'll put it in for you. So those are, some of them are hormonal, some of them are not. So those are options. And then we have permanent birth control. Permanent. When I say permanent, that means it can be reversed, which is tubal ligation. Tubal ligation. For men, there is vasectomy. Yes, men too can have vasectomy. If you don't want to, responsibility falls on both of you. Whoever wants to do it, you can decide amongst yourself. The man can have a vasectomy. The woman can have a tubal ligation. You have to decide whichever one works for you, and you have to decide who goes for it. All right. Please understand that these are irreversible. I know there are some places that are like, okay, they can reverse it, It's irreversible. Let's just put it that way. Keep it simple. You can't reverse it. So those are your options. Options, again, we have hormonal birth control pills, injection, NuvaRings, all those rings. Sorry. You have that. You have barrier. We have condoms. We have cervical caps. We have diaphragms. We have long-acting, implantable, reversible. We have implants. We have coils. We have IUDs, intrauterine devices. You have those options. And then you have irreversible, the one that cannot be reversed. We have tubal ligation for women, and we have vasectomy for men. So again, sit down with your doctor and determine which one works for you. All right. Now, some people are like, well, I don't want to do all of that. I don't want to do all of that. Okay, we have the calendar method where you sit there and you count day 1, day 2, day 3. And I hope you ladies know how to count your period. Like your first 14 days is your follicular period, and then you have your ovulation period, and then you have your luteal phase. So you can get pregnant during your ovulation. The first 5 days around your ovulation, you can get pregnant. Possible. After that, it may happen, it may not. So calendar method. Also, some people do with withdrawal method. Please understand, if you don't withdraw method, that you can still get pregnant with the pre-ejaculation fluids. Possible. They call it pre-com. Yes, you can still get pregnant with pre-com. Yeah. So please understand that. Don't say, oh, but he didn't completely ejaculate into me. Yeah, no, even that little talk still happened. I remember trying to use IUD. My gynae could not, because my cervix ended with tubal ligation. Okay, Mr. O'Donnell, that is an option. Yes. So yeah, that's an option. That's good. All right. What are the myths that we have is that birth control causes infertility. No, it does not. When you stop your birth control, I think the fastest one that returns quicker is the pills. If you stop the pills this month, by next month, if you are not careful, you will get pregnant. I think also the IUD comes after that. The one that takes longer is if you get the depot shot, the injection. That one lasts about 3 months, and after 3 months of those, I think you can your period. You can get pregnant after that. Vasectomy, of course, is not reversible. Condoms, stop using condoms. Cervical caps, once you stop using it, things like that. Your taking birth control pills does not affect your fertility, does not cause infertility. All right. IUDs are dangerous. No, they're not. It depends on who puts them in, or it could be mechanical issues, but IUDs themselves are not. Many women are on IUDs, and they're doing well, and they're living their lives. All right. So, like I said, how do you choose what works for you? You have to understand what is going on in your body. You have to understand your health conditions, what's going on with you, and you and your doctors will have to sit down and decide, okay, based on, okay, you have hypertension, you can't take this one. You have diabetes, you can't take this one. You have high cholesterol, maybe this one can work for you. Things like that. You have to discuss with your doctor, and then they'll help you come up with options of which one you can go to. All right. What is your personal preference and lifestyle? What do you like to do? Are you actually in a relationship? That's another thing. Are you in a relationship? Okay. Does that, like, are you one, like, you have friends with benefit? Things like that. What works for you? We are not here to judge as healthcare professionals. We're here to listen to you and help you make decisions based on what's going on in your life. So please, your doctors are not the one you want to hide from. You don't want to hide your health issues from your doctors, because unfortunately, there's some birth controls that people with hypertension cannot take. There's some birth control with people that are prone to clotting disorders cannot take. So if you hide from your doctors, you're hurting yourself. All right. Okay. Now, let's talk about fertility and family planning for a little bit. Okay. Understanding fertility. And no, I just went through earlier, like, ladies, please understand. A lot of women say, oh, they're not getting pregnant. They're not getting pregnant. And one thing I've come to find out when people come to me is they don't know how to count their period. You don't know how to count your cycle. All right. Every woman has a cycle, a menstrual cycle. It goes between 28 to 35 days, if I'm correct, like between 28 and 35 days. Each body is different. I personally have a 27-day period calendar day. I don't like that. I wish I had a 35-day one so it can be longer. But every 27 to 28 days, I have my period. So day number one, it depends on how you want to count it. So day number one is the day I will count that as the first day of your period. All right. Your first day of your period is the number one. So the period cycles differ. Some people are blessed with 3 days. Some people are blessed with 5 days. I'm the blessed with 5 days once. Some people are blessed with 7 days. So you know how many days your period actually lasts for. All right. So day number one, for the first 14 days, 10 to 14 days of your period, of the day, like from your day of your period, is what we call your follicular phase. All right. This is when your eggs are growing and all that good stuff and all that. And then when they're mature enough, all right, then we go into the ovulation phase. All right. Ovulation phase, but I count about 5 days. Okay. So that 5 days before your body releases the egg, you can get pregnant. And please also remember that sperm can last in your body for 5 days and will be fine and it will still get pregnant. Like you have sex today and you don't ovulate until 2 or 3 days later, you can still get pregnant. Sperm can live in there nicely, no problem. And you can still get pregnant. Okay. Now, after that, after your ovulation phase, we have your luteal phase where your body is waiting for egg to implant. And if it doesn't implant, the walls of your lining shed and then you have a period and that's another cycle. So all that, it's a whole cycle. Ladies, if you have any questions, come to me and we'll discuss it further. And we can say, hi, Miss Linda. Thank you for joining. All right. So factors that affect fertility. What are the factors that affect fertility? All right. We have your age and biological clock. It affects both male and female. But unfortunately for female, it comes a little earlier. They say after 35, your fertility begins to decline. Not to say that you can't get pregnant. You can still get pregnant. It is still possible. But they just say at that point is the average age that fertility starts to decline. Okay. Men, your fertility also starts to decline. Understand that and say, oh, I can still get pregnant. I can get anybody pregnant. Please understand that your sperm quality also declines and you can contribute to, having pregnancy issues, causing miscarriages, all that because of the sperm quality. So that also counts. All right. The lifestyle you live also contributes to your fertility health. All right. If you smoke, if you drink, if you don't eat healthy, all that contributes to your fertility health, to your, fertility. All right. To maintain adequate fertility, you got to make sure you're eating well. You're eating your vegetables. You're taking your vitamins if you need it. You're exercising. All right. You are not smoking and you are not drinking alcohol. All right. All these things help your body. Okay. All right. If medical conditions that may impact your fertility, we've talked about a couple of these. We've talked about endometriosis, adenomyosis. We've talked about PCOS. All right. Low sperm count for men. That can also that can cause issues with your fertility. All right. And exposure to chemical, exposure to radiation, extreme heat. All right. Men, let the boys breathe, things like that. All these can affect fertility. All right. So when do you seek out your fertility specialist? Ladies and gentlemen, when do you seek out a fertility specialist? If you're below age 35, if you've been trying to get pregnant for a year, seek out a fertility specialist. If you're above age 35, if you're above age 35 and you've been trying for 6 months without anything, consult a fertility specialist. And fertility specialists are not gynecologists. They're reproductive endocrinologists. You need to reach out to one of those. They are specialists. All right. Okay. So what did we talk about today? We talked about family planning, why you need it. All right. We talked about different types of birth controls that are available to you. We talked about the condoms. We talked about the pills. We talked about calendar method and withdrawal methods. We talked about IUDs. We talked about implants. several options are available for you. All right. We talked about spacing your children so your body can heal and you can have a healthy delivery, healthy pregnancy. We talked about that. We talked about things that may impact your fertility if you're not eating well, if you're drinking alcohol, if you're not exercising. All these may affect your fertility. This applies for both men and women. All right. So if we have any questions, this is a good time to ask your questions if you have any. If you do not, well, this is where I will say goodbye to you. I'll bid you adieu. And I will say thank you very much for joining me today. I appreciate you. All I ask is you please share this video, click the share button, encourage me by sharing this video. I don't ask for anything but share this video, invite your friends, invite people to watch, and we can discuss together. And this video will be placed on YouTube if you miss it on Facebook Live, because Facebook is not deleting live videos. I will download it and place it on YouTube. Follow me on Health Talk with Dr. Mutiat on all social media platform. I am on TikTok, I am on Instagram, I'm on Facebook, and now I'm on YouTube. So follow me there. It's been a pleasure. Thank you so much. Thank you. Have a great day and take care of yourself. Dr. Sunshine